Annita Shaw, born February 13, 1941 in Scottsbluff, Nebraska, as Annita Louise Crawford, was adopted a few days after her birth by Harold Kenneth and Valma Sally. Kenny and Sally brought their precious baby daughter home in their farm north of Henry, February 14, 1941. Annita did all of the things children of her age did: prepare household meals out of raw materials found in the yard, laid out the dimensions of an imaginary home. She helped in the fields, hoeing beets to thin out of the plants, or helped her father irrigate the corn crop or any other row on any other crop grown. She rode horseback to get the milk cows to come in to be milked in the evening. Her dad milked them again in the morning prior to letting them go out into the pasture or to graze on the grass in the evenings. She attended a county school where multiple grades were taught in the same room. She did projects for the 4 to 8 programs. She went to junior high and senior high school in Murrill, Nebraska, graduating with the class of 1959. Annita attended College of Chadron, where she was part of the last group to receive normal training prior to graduation. She received her bachelor degree after teaching in small-town school district elementary schools. She then taught to inner city schools in Omaha prior to heading off to the big city, New York, to attend NYU for her master's. As children, Max Leroy Shaw had been warned to keep his hands out of the crib. Little to know the rest of the family, Annita and Max would lock eyes at his sister's wedding and realize that they were meant for each other, after having known each other as cousins their whole lives. They were wed on June 29, 1968 at their childhood church in Henry, Nebraska. Annita went into education, getting her first position in Bridgeport, Nebraska. From there, she went on to 2 other districts, teaching 2nd and 3rd elementary level students. She was discovered by the Omaha School District, hired and taught in the projects of Omaha, Nebraska, but then moving to Connecticut and California with Max, before finally settling down with Silverdale, Washington, where she had their son, Justin Owen Shaw, and he was born. She taught in the Central Kitsap School District for 29 years. Although she started as a substitute, she became the art teacher at Fairway Junior High, also occasionally teaching language arts and becoming the long-term yearbook advisor. She was nominated for and awarded for Art Educator of the Year for the National Art Education Association, and she was acting president of the Washington Art Education Association for many years. She was the recipient of the Trista McAuliffe Excellence in Teacher Education Award and many other accolades for her art program and curriculum. She participated in the Commission on Student Learning. In addition, she kept extraordinarily busy in her retirement from teaching by assuming her new role of owner of the family farm, managing the farm as well as the rental properties. In 2007, she founded a non-profit foundation to educate people about the dangers of neuropathy, which leads to Charcot, a bone-destroying disease that attacks load-bearing joints of people who haven't necessarily known what neuropathy is. It produces a lack of sensation in the lower arms and legs. Charcot is fairly common in type 2 diabetics and almost the occurrence in the rest of the population. If Charcot has medical intervention, amputation can often be avoided. As in Annita's case, medical intervention helped save her feet from becoming casualties of Charcot. In Madigan Medical Center, the surgeon performed the delicate work necessary to repair already damaged bones in the right foot and lower leg. The healing time was almost 2 years, and during that time she was off her feet, using a wheelchair to move around. There was damage to her left foot, but not to the extent in the right. After her first surgery had healed, she underwent a similar procedure to repair the damage to her left foot. During an appointment with her lawyer, he strongly urged Annita to start an educational foundation to help the public about the dangers of Charcot. The major problem is getting the message out to those who need it, and firmly held belief by podiatrists that it was a rare problem and that they're not realizing that those who have amputations are almost without exception. Type 2 diabetics during the time of the 501c3 We have been in an uphill battle with it among disbelievers ever since.